Good morning, everyone. I hope you all are doing well. Thank you so much for joining the webinar today. So we are here to talk about something that's really transforming the healthcare, which is Epic EHR integration. With patient care getting more complex, hospitals and clinics need smarter ways to work efficiently and make better decisions. That's where Epic EHR makes a difference. So let's get started. Before that, let me introduce you with the presenters of the session. So we have Ashfaq Inamdar today, who is a software engineer. Myself, Nikita Soni, senior QA engineer. Then we have Sandeep Singh Negi, senior software engineer working at Mindbrowser. So let me go through the table of content that we are going to cover today. First of all, we have what is an EHR, then Epic EHR, a brief introduction, why integrate Epic EHR, understanding the FHIR APIs, Epic's use of FHIR APIs, OAuth 2.0 authentication. Then we'll have a demo from the front-end integration. Afterwards, we'll cover the backend service flow overview. Then we have FHIR resources, challenges and solutions, security and best practices. Afterwards, we'll be having a demo from the backend integration. Then we'll see some testing strategies for FHIR integrated applications. And at last, we'll complete the webinar by some learnings. So let's get started. Let me give you a brief introduction about what an EHR is. An EHR is basically a digital version of patient's entire medical history. It helps the healthcare professionals provide better care by offering healthcare integration, patient information, digital medical records, clinical history, and health data. So let's look into it one by one. Healthcare integration, which is basically everything providing at one place. Imagine going to different doctors for different issues, one for a regular checkup, another for an allergy, or maybe to a specialist for a chronic condition. What EHR does, it makes sure that all these doctors have access to the same updated information about your health, so that you don't have to repeat everything every time whenever you go to different doctors. So it basically connects the different healthcare systems for smooth sharing of information. Then we have patient information. It includes the basic details like your name, age, medical history, things that the doctor needs to know before treating a patient instead of keeping a track of their past illnesses, diagnoses, allergies, all the medications on paper. EHR stores everything securely, ensuring that the doctor always have the right information at the right time. Then we have digital medical record. EHR turns everything into a digital format. So no more lost files now, making it easy for the doctors to access, update, and share the patient's medical record instantly. Whether they are seeing a new doctor or switching hospitals, they can quickly pull up the patient's record and continue the treatments without any delays. Then we have clinical history, which is a patient's overall health journey. Every visit to a doctor, every test, every prescription, it all becomes a part of one's clinical history. EHR keeps a detailed record of past illnesses, surgeries, vaccinations, and treatments so that the doctor can understand the health pattern and make better decisions for the patient's future care. Then we have health data. It is basically keeping you on track. EHR collects all kinds of health-related data, which is your vitals like blood test results, heart rate, blood pressure, and even fitness tracking information. This helps doctors monitor patients' health over time and even predict the potential risk before they become too serious problem. So a question may arise why it is important. So this is important because you don't have to remember every detail of your medical history. It's there for your doctor. Doctors work better when they have complete information. It reduces the risk in prescription and treatments, and your data is securely stored, protecting your privacy under laws like HIPAA. So in short, we can say that EHR makes healthcare smarter, faster, and safer for both patients and the doctors. Now let's have a look at the different EHRs available in the market. So here, as you can see, we have put together Advanced MD, Practice Fusion, eClinicalWorks, Greenway, etc. So among all these, Epic is one of the biggest EHR provider in the world. It is used by many large hospitals. It allows seamless sharing of patient data across different healthcare systems and used by numerous healthcare organizations across the United States. Then we have Advanced MD, Practice Fusion, eClinicalWorks. These are all cloud-based EHR designed for small, mid-sized, and large practices. Basically, it helps the doctors scheduling the appointments for the patients, manage billing, and keeping track of patient records all in one place. And we have Greenway Health, Cerner, NextGen Healthcare, and Allscript. All these offer solutions for medical practices of all the sizes, helping them digitize the patient records and provide better care. It focuses on improving workflow efficiency and reducing the paperwork for healthcare providers. Then we have KAO. It is ideal for independent medical practices, offering easy-to-use EHR and billing tools. It helps the clinics with scheduling, patient communication, and patient charting. Then we have GE Healthcare. It provides a comprehensive suite of EHR imaging and patient monitoring solutions. It is also used by large hospitals and healthcare systems to streamline their clinical workflow. Then we have Amazing Charts. It is used for small practices. It helps reduce the administrative burden for physicians so that they can focus more on the patient care rather than doing the administrative work. So that was it about the different EHRs and a brief introduction. Now that we have covered the basics, let's dive into how it can be effectively implemented in a healthcare setting. To walk us through the key steps and best practices, I'll hand it over to Ashfaq. Ashfaq, over to you.
Yes, thanks a lot, Nikita, for the brief intro into EHR system. So now let's look at some facts and features of Epic EHR. So Epic is a leader in electronic health record space. So it is used by some of the most largest and most respected healthcare organizations. Many of the top ranked hospitals in the US also use Epic, so making it one of the most trusted EHR solutions in the world. Its scalability also makes it suitable for both small practices as well as large healthcare networks. So what makes Epic truly powerful? It is all-in-one approach. So it offers comprehensive management for patient record, billing, scheduling, etc. So it integrates everything from medical histories, prescription, test results. So it also makes it very easy for billing and revenue cycle system, which ensures timely claim renewals. So patients' appointments are also made easy, so which reduces patient wait times. So Epic is also widely used across the healthcare industry. So Epic's reach is very extensive. It's used in hospitals, specialty clinics, academic medical centers, and even government hospitals. Additionally, Epic's interoperability offers different healthcare organizations to connect and share data seamlessly. Can you have the next slide, Nikita? So let's understand first what FHIR API is. So FHIR basically stands for Fast Healthcare Interoperability Resource. To understand the role of FHIR API, let's use an example. So suppose you are traveling to a new city and you need to withdraw some cash. So you don't worry about which ATM you're using because they all follow the standard protocol. So now imagine if in healthcare it works the same way, like allowing doctors, hospitals, apps to access your information seamlessly, regardless like where it is stored. So that's exactly where FHIR in API comes into picture. To understand the use case, let's say you are on vacation and you suddenly feel unwell and you need to visit a doctor. So you visit a nearby clinic, but a doctor there has no information regarding your previous medical history. So without crucial details like your allergies, ongoing medications, or past diagnosis, so making an accurate treatment decision becomes very difficult. So this is where FHIR API makes a difference. So with FHIR integration, the doctor can easily retrieve your previous medical records from your previous care system. So no matter on which hospital or clinic you usually visit. So instead of waiting for days for paper records or manually entering data, the clinic system securely pulls data and then the real information in real time. This ensures that you receive the right care, avoid medication conflict, and experience a smooth healthcare journey. Can you have the next slide, Nikita? So Epic's use of FHIR API. So Epic provides some FHIR compliant APIs. So you can integrate these APIs with any third-party applications. So these APIs are available 24/7. So they can be used to access patient information, book appointments, clinical notes, and much more. Can you have the next slide, Nikita? So Epic's database usually contains very highly sensitive patient info. So security is a top priority. So it uses OAuth 2.0 protocol. So it's basically a 4-step process, as you can see. So first is the user login. Then we generate an auth code. In the next step, we exchange the auth code with an access token. And after getting the access token, we can access the FHIR APIs. So let's understand OAuth 2 with an example. So let's say you download a fitness app, so that wants you to connect to your Google account to fetch your health data. So instead of creating a new account, you click login with Google. So at this point, the app redirects you to the Google's homepage. So where you enter your Google credentials and press login. Next step is the auth code. So after logging in, Google doesn't immediately give you the fitness app the access. It asks for your permission, like, do you want to allow this app to access your data? So you approve, Google generates a short-lived token. Now we exchange this token with the access code. Now that the app has the auth code, it needs something more permanent. It sends the code to Google's authentication server along with the secret key. So if everything checks out, Google responds with an access token. So it basically allows you to call the FHIR API. So the next step, with this access token, the fitness app can securely request your health data from Google servers without needing a password. So the app uses the token until it expires, so at which point the user can request a new one. So OAuth 2 ensures secure and seamless access to user data across platforms. It is used in apps, cloud services, and APIs everywhere. So by implementing OAuth 2, Epic helps organizations comply with regulatory requirements like HIPAA, which enables better integration with external applications. Can I have the next slide, Nikita? Okay, so now I'll guide you with a small integration demo. Nikita, I'll take the screen share. Okay, so Epic provides this web portal, fire.epic.com. So in this, we have all the 5 APIs. So you can access patients' encounter, their observation, their condition, their medications, their vitals, and all that. So the first step is to sign up. So if I click on sign up, it will open this page. So here you need to provide some basic details like your first name, last name, company email, phone, company name, website, and country. So after clicking submit, your account will be created on this Epic portal. So this account is mandatory to access this APIs. So I already created an app. It's already registered myself. So I'll create an app. So what this app is, basically it acts as a bridge between your external application and Epic. So suppose take an example that I'm building a heart rate tracker app. So I need to access the Epic database to retrieve the heart rate data. So the first step is to create an app. So I'll provide the application name. Suppose it's a heart rate, just name it heart rate tracker. So patient audience, basically like who will be using that app. So if it's patient, then patient. If it's clinician, then clinicians. If it's a backend system, then backend system. So public documentation URL is like if I'm building an heart tracking app, I need to provide the documentation like how people can use my app. So here you can post a custom link to your third party app. Incoming API. So these are all the APIs available. So if I want to add an API, I just need to search the API. So if I search patient.read, so what this API does, it fetches the relevant patient information. So I can add it to my selected tab. So my app will only use these APIs. So you can add as many as you want from here. Like depends on the use case. Redirect URL, again, this is a OAuth 2.0 thing. So after authentication from Epic, you can redirect it to your own website. So after these are non-mandatory steps, so you can click save. So I already created one app. So let me open this. So I named it clinicians. So after registration, you will get two IDs. One is client ID and one is a non-prod client ID. For testing and development purposes, we can use of this non-prod client ID. If I scroll down, then I need to select a smart on FHIR version. So there are 3 versions currently. So DSTU2 is the oldest. STU2 3 came after DSTU2, and R4 is the latest. It's recommended to use R4, but if you are using an older version of Epic, they can select DSTU2. So again, Smart Fire Scope, we can select version 1, version 2. That's based on your choice. So summary is like I can provide a basic summary about my app, like what my app does. So again, coming back to that heart rate track example, I can post a brief summary about my app, like how it keeps your data, how it tracks heart rate and all that. I also provide a description. I can also provide the intended purposes, set some thumbnails, some screenshots. And if I go at the bottom, I'll get a few buttons over here. So first is the save and ready for sandbox. So this makes my app ready for testing. So I can make development using Epic. So save and ready for production. So it will make your app ready for production. So you can use your client ID, broad client ID. And there's one more option called request connection hub listing. So what this does is it submits your app for review. So Epic, they have sort of a marketplace where you can list your apps. So they will approve your app. If everything checks out, then they will list your app. So like if other hospitals can also integrate your app. So if other systems use Epic somewhere, so they can go through your app and integrate it, like what it basically functions. So let me just go into my code now. So I have created some variables, redirect URI. So this is my local development variable. So URL, this is the base URL. So if I have a FHIR API, I can attach the endpoint over here with the base URL. And this is my client ID. The state is optional. You can edit if you want. So basically, there are 3 launch sequences on Epic. One is the standalone launch, which we are going to focus on. The second is embedded launch. So Epic has a software named Hyperspace. It's a standalone software. So you can launch your app within a window mode in Epic. And the third type is backend system, which doesn't require any user interaction. So let's focus on standalone launch. So I created a dummy health clinic called Divine Health Clinic with a login button. So on click of login button, I'm generating an auth URL. So this is the base URL again. So here I pass the redirect URI, the client ID. The audience is mandatory. You can pass it if you want. So again, this follows an OAuth 2.0 flow. So on click of this, I should be redirected to the Epic authentication page. So let me click login. So it does redirect me to the Epic Hyperspace web portal. So here it's asking me for a username and password. So again, going back to the Epic website, I can go into documentation, click on sandbox text data, and here I'll be presented with some dummy users. So you have a username and a password. So I'll fill that up over here. So once everything works out, it's asking for access. So again, yeah, it's basically authenticated me. So I got a code from Epic. So I converted this code into auth token using the token API. Again, this is an OAuth 2.0 flow. So now I have got the access token. So let me just go into documentation. So it also provides us with some test patient with their FHIR ID. So this FHIR ID is unique for every patient. So and these are the applicable resources which you can access. So there is medication, medication order, patient procedure, and all that. So I'll copy this and I'll paste it over here. Yeah, so I have got the patient info, like the patient name, which is Camelia Maria Lopez, her gender, date of birth, hemoglobin, platelets. So I'm basically accessing the patient info here. So this is the proof that our access token works. So if I go into the Epic website and if I go into the API specification, so here Epic, like it lists all the API which are available on their platform. So basically I can search the API, I can try them out. So if I again search the patient.read API over here. So it basically gives me an option to try it out as well here. And I also can check out like how the response usually looks like. So it also provides us with a dummy response. So we can play around with this API specification. So once we get the access token, all the APIs are available to us to like experiment. Yeah, so that is it from the front end demo. Nikita, I'll let you take over the screen share. So now that we have walked through the front end demo, so now let's focus on the back end, like how the integration and data handling works. So I'll pass it over to Sandeep.
Yeah, thanks, Ashpal. Till now, we have seen the Epic integration from the front end. So now let's move to the backend service flow for integrating FHIR with Epic. So here you can see I have divided the backend flow into 4 steps. First is authentication, then comes inbound data, then data transformation, and then outbound data. So first let's see the authentication. So FHIR uses OAuth 2.0 for secure authentication. This ensures that only authorized system can access or share sensitive data. Imagine OAuth 2.0 as a secure key that lets trusted application access specific information without compromising the security. Then comes the inbound data. So FHIR provides structured access to essential information. When Epic sends data to our system, it follows a standardized format, allowing for efficient retrieval and integration. So each of these data is accessed through a specific resource endpoint. For example, we have patient, encounter, observation, uh, and appointment, and there are other resources which make it easy to retrieve the exact information you needed. Then comes the data transformation. So FHIR data is in JSON format, which is lightweight and easy to read. However, healthcare system may need this data in a different format for internal process. For example, JSON patient data may need to be converted into structured data table for analytic or reporting. We can use middleware to handle this transformation automatically, making data flow seamless. Then comes the outbound data. The system can also push update back to Epic, such as new lab results, appointment changes, and updating medication records. So this keep Epic up to date with the latest information, ensuring clinic always have access to current patient data. Nikita, can we go to next slide now? Yeah. So FHIR provide standardized resources for various aspects of healthcare data. These are key resources that enable seamless communication between systems. So first is patient, which contain essential patient information such as name, age, contact detail, and address. Then we have encounter, which capture details about interaction between patient and healthcare provider, including doctor visits and hospital stay. Then we have appointment, which manages scheduling information for patient visits, including the time slot and provider availability. Then we have observation, which has the clinical records such as lab results and vital signs. Then we have medical requests, which keep track of prescribed medicine and their status. Nikita, can we go to the next slide now? So while FHIR offer numerous benefits, there are some challenges. So first is rate limit. So Epic FHIR API have request rate limit to maintain system performance. So solution to it is using throttling to control the number of requests sent. This ensures that we stay within the limit while maintaining efficient data flow. Then we have data transformation. So FHIR data may not always be in a format that your system can use directly. So we can use middleware to handle that transformation, mapping FHIR data fields to your system's internal structure automatically. Then there is always a risk of creating duplicate records, such as when a patient is registered multiple times. So the solution we can use is implementing robust matching algorithm to detect duplicates. For example, comparing the patient MRN number with the encounter ID or date and time can help identifying and eliminating the duplicates before saving those records. Nikita, can we go to the next slide now? So as security is paramount when dealing with the healthcare data, here are some critical best practice which we can follow. First is secure storage of token. So OAuth token must be stored securely in encrypted storage or in a secure vault to prevent unauthorized access. This ensures that sensitive data remain protected. Then to minimize the security risk, we can use short-lived token that expires quickly, and always have a mechanism to generate new token when needed. So that's for the token expiration. Then as we know, compliance with the HIPAA regulation is non-negotiable. So key practice which can be included is encrypting sensitive healthcare data. You can ensure all data both in transit and at rest is encrypted. And we can have access restrictions. So grant access only to authorized user based on their role while maintaining the detailed log of data, who access what information and when. Can we go to next slide now? Yeah, so now I will be like demonstrating a small demo for the Epic using backend service. So let me just share my screen now. So I have created like 3 endpoints. So one is for authentication, in which we will be using OAuth 2.0 for authentication. And then I have created 2 patient endpoint, one with the patient raw data, which will contain the patient unprocessed data, which we are receiving from the patient resource using the patient MRN number. And then there will be a patient slash MRN API, which will have the customized version of the patient data, which required by our application. So first, let's move through the OAuth 2 authentication. So before that, like I have created one app here, which you can see as medical app, and we have the client ID and non-prod client ID. So for the demo purpose, I have used the non-prod client ID. And in application audience, we can select the backend system because we are integrating it from the backend. Here you can see I have selected few of the resources which I will be using for my application. So one of it is patient.read, patient.search, then we have observation and other also like procedure. We can select according to our application requirement. Then here I have uploaded the public key, which comes with the public private key combination. So public key I have uploaded here for sandbox environment only. For the non-prod and prod environment, we can use the JWK URL, which adds on an extra layer of security to the integration. Then I have selected the FHIR version, which is the latest one, which is R4. Then we can select the smart scope version from here, and all other fields are like non-mandatory, but you can select it based on your application requirement, like intended purpose and intended user. Now if I go back to my code here, so I have created a method in which I have used the Epic base URL and the client ID, so that I have like saved in a different file. And after that, I have created a message JSON, which will have the client ID, the audience, and the token creation time and the token expiry time. Then I have imported the private key. So in the app, we have uploaded the public key. Here we will be using private key for encrypting this message. So I have used JWT encode for creating the encoded message using this message and private key. So that message I have passed then into the OAuth 2 token, and in return we will be getting the access token. So if I go back to this API, and upon execution, you can see we get the access token and the token type, which is bearer, the expiry time of the token, and the scope. So these are the scope which I have added from the application. We can add those scope according to our application requirement. Here you can see I have selected appointment.read, document.read, write, encounter, medication. We have patient, procedure, observation. So I have selected these for my application. Now, once the user is authenticated, we have the access token. We can call the patient resource using the patient MRN number. Now, so this is the MRN number which I have used for the demo purpose only, and it is just for the sandbox environment. So upon execution, you can see we got a response something like this from the Epic. Now behind the scene, what happened is it calls the FHIR Epic with the R4 version, and the resource is patient. The identifier is the patient MRN number. Now in the resource, we have the resource type as patient, the ID, which is the patient ID, which will remain unique throughout the Epic. Then we have codable concept, which are system generated codes, and we have extensions, which are not like followed by the standard of Epic, but they are entered by the hospital for their internal purpose only. Then you can see we have the name information, the patient name, the telephone detail of the patient, gender, date of birth, whether the patient is diseased or not. Then we have address, marital status, and the contact of relation, relative information. Then we also have the other information like the practitioner and the organization which is managing the patient. Now, this is how we will be getting the response from the patient resource. And a lot of data is not like useful for our application. So what I did is I created one more endpoint which will be having the. So here I have used the same MRN number of the patient, and in this API we will getting the customized version of the data. So here you can see I got the MRN number, patient ID, date of birth, gender, race, ethnicity, first name, last name of the patient. So this is how I have customized it for my application. So in the similar way, you can also customize the data based on your application requirement. And we can also like fetch the information from the different resources, just like I got it from the patient. So there are like other resources like encounter, observation, appointment, medication request. So from all of those, we can use the same access token and get the patient data, get the resource data and customize it according to our requirement. I think so that's it from the demo side. Now, like I will hand it over to Nikita for the testing strategies.
Thank you so much, Sandeep. So now let's look at some testing strategies for FHIR integrated applications. Here we have listed few. First one is data validation, then validating the OAuth 2.0 flow, resilience, and HIPAA compliance. Under data validation, it is critical to ensure the accuracy and completeness of healthcare data exchange between systems. It involves verifying the data formats, all the required fields are populated, and the information follows the FHIR resource schema. Only valid, structured data should be accepted and processed. For instance, if in your application, you require that the temperature data to be in Celsius and you receive the temperature in Fahrenheit from Epic, then it needs to be validated that it is getting converted correctly. Similarly, we can validate the other information received from Epic. Validating OAuth 2.0 flow for standalone applications. It plays a crucial role in ensuring that the authentication and authorization process works as intended. As a tester, our focus on verifying that after logging in, the application redirects us to the Epic hyperspace login screen, and once authenticated, it should navigate back to our application with a valid access token. Additionally, we also need to ensure proper token handling by checking that the access token functions correctly with the FHIR API, while also assessing API interactions for seamless communication between the application and the external system. Then we have resilience testing, which evaluates how well the system copes with the challenges such as network failure, data processing errors, or system crashes. We simulate scenarios like service timeouts and high API request loads to ensure that proper fallback mechanisms are in place. Additionally, it's essential to verify that the system recovers seamlessly without any data corruption, thereby maintaining data integrity and consistency performance even under the stress. Now we have compliance, which includes the HIPAA testing strategy. Under this, we see data minimization, access control, data retention, and audit logs. Data minimization, ensuring only the necessary protected health information is shared and stored. For example, if you are getting information related to the patient ID from Epic and your application doesn't require this information, then you can omit it. Access control tests that only authorized users can access the specific category of health information. And data retention policies validate data retention and secure deletion in compliance with HIPAA guidelines. For example, if your application demands that the patient records to be automatically deleted 24 months after they are entered into the system, then it should work accordingly. Audit logs, Validate the audit logs are maintained for all the data access and the modifications. So these were the testing strategies. Now let's look at some tools for FHIR integrated applications that we can use. So we have Burp Suite, Zetdetect Proxy, JMeter, Apache, Postman, Splunk, and Wireshark. First of all, Burp Suite. Think of this as a security guard for web application. It helps to find the security weaknesses in the system, such as vulnerabilities that the hackers could exploit. Then we have Zettetect Proxy, which is used for penetration testing. It helps identify security flaws in the application. It acts like a hacker by simulating attacks to see if the system can withstand them or not. Then we have Postman. It is like a messenger that sends and receives the data request, helping to ensure that the APIs which connect different system parts works correctly. Then we have Apache JMeter. This is basically a performance testing tool, which checks how well our application handles the traffic. It simulates multiple users accessing the system at once to ensure it can handle a high number of patients and healthcare professionals using it simultaneously. Then we have Wireshark, which is a network detective that captures and analyzes the data flowing through the network. It helps to understand if the patient data is being securely transmitted without any leaks or not. Then we have Splunk. Think of this as a data investigator. It collects and analyzes the logs from different parts of the system to detect the errors, security threats, or performance issues. So now let's see some key takeaways from our session on Epic EHR integration. So first of all, we learned smooth data sharing. We have learned that how integrating Epic with FHIR makes it easier for the healthcare system to share information. This means that the doctors, nurses, and care teams have access to your updated data, which leads to better decision making. Then better patient care. With real-time information and streamlined workflows, healthcare providers can deliver more personalized and timely care. This integration helps reduce errors and ensures that everyone is on the same page. Thorough testing for reliability. We have discussed the importance of robust testing, from ensuring data accuracy to verify security compliance like HIPAA. This helps keep our system dependable and safe, which is crucial for patient care. Then we have numerous interoperability benefits. By enabling system to communicate seamlessly, interoperability not only boosts efficiency, but also encourages collaboration across different healthcare platforms. This connectivity empowers providers to offer a more holistic approach to patient care. So these were the learnings from this session. Thank you so much for your time and attention. If you have any questions, you can drop it in the chat and we will answering them one by one. So we are currently hiring for these positions. If you are passionate about development or design, this might be the perfect opportunity for you or someone in your network. If any of these roles interest you, feel free to reach out at hr@mindbrowser.com with your updated resumes. We would be happy to discuss how you can be a part of our team. Thank you so much for your time and attention. I hope this session gave you a valuable insight into Epic EHR integration and testing strategies. If you have any questions, feel free to reach out via the provided email addresses.